Hi, everyone. Stephanie again with the patient story, and joined by Montessa for the second segment of her small cell lung cancer story. Thank you, Montessa. You just got through talking about how you got diagnosed, how you were able to sort of process the diagnosis, how you broke the news, how you approached second opinion. All very important steps, I think, in this experience, if you will. So I know then you mentioned that chemotherapy and radiation, you got started right away because hello, 15-centimeter mass, I'm sure they weren't playing around.
Right.
Um, can you describe the regimen? What was the chemo regimen? Do you remember the drugs and, just the schedule of infusions, and were you inpatient, outpatient? And I know I just threw a whole bucket of things at you, but you had also mentioned getting a PIC line
Mhm.
for the chemo, right?
Yep. Oh, yep. So originally because they wanted to start the chemo right away, like you said, so they started PIC line, and I won't forget this either, even though I do say chemo. Sometimes chemo has affected some of my memory, but they put the PIC line in, and I remember it wasn't pointed in the right direction. They had to go back down to interventional radiology to get it pointed in the right direction. And this, these things in my mind when they're like, if we can't get it, and again, I don't know why they tell patients all these, but they were like, if we can't get it to work through your arm through here, we have to go up through your thigh or something. I'm like, oh no, 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 so so they got it working. Just they had to shoot some saline in there or something, and got that working. Start the chemo right away. And I remember one of the nurses saying, "Oh, I want it to be there to start it," which was quite interesting. It shows you that personality and the bedside manner of the nurses.
Right.
Um, and they started it then. And oh yeah, so I must have had the surgery after that first round, and they put the Metaport in, and um, did that periocardial window. And I started radiation when I was hospitalized as well. So the radiation oncologist explained it was going to be about 22 days straight of chest radiation, and they were going to resize and re-image the area so they wouldn't be radiating good tissue. Because with small cell, that if you know about small cell, usually it responds well to that first round of treatment, but it tends to come back. And so the goal was, of course, to shrink that tumor, with simultaneous radiation and chemo at the same time. So they explained, and this was a different little caveat, because when I was released from the hospital, my oncologist, had rights for the infusion center at another hospital. So, but the radiation oncologist was at hospital A. I'll say hospital A and B. So I would have to get picked up, and the church arranged rides for me. This
Oh,
was
wow.
just miraculous. They arranged rides for me to be picked up at my house, take me to radiation treatment. Somebody picked me up from the radiation hospital A, and take me to B to get the chemotherapy on the days that I had double lapping
Mm,
of both radiation and chemo. And the chemo would be um, cycles of like three, like, so I would go, and I remember it like this: week one, I'd have blood work done on Monday, Tuesday, Wednesday, and Thursday. I'd get chemo Friday. I'd get fluids. And they started with cisplatin and etoposide. And eventually I had to change to carboplatin because I had my ears ringing in my ears. And so the platinum based chemotherapy was affecting my hearing.
right.
Mm. So so somebody would pick me up, take me to the hospital, and it would be like every 3 weeks. So, that week, it would be chemo week, and my mom would come up and from North Carolina those weekends. I had chemo treatments. And then I would have another week of blood work and chemo week. So every 3 weeks I'd have these chemo weeks. And it got to April, and I was so fatigued that the doctor had to change the regimen a little bit. So I had to take like a week off of the chemotherapy treatment, because that type of fatigue, I can't even describe it. Even to walk from my apartment around the corner to a neighbor's apartment took every bit of energy
Yes. Right.
I could muster up. Mm.
Absolutely. No, it was very extreme fatigue. That might be an instance of self-advocacy. You let the doctor know what you were feeling and
Mhm.
they adjusted, right?
Yes. Yeah, because in my mind, I didn't think, that he was going. I was just like, the biggest, and I give him credit too, because from my other little advocacy groups I've been a part of, sometimes they say that the doctors don't even ask them as a whole picture of how you're doing, Are you having any insurance problems, money problems? What are your issues? How are you?
Right.
Not just the treatment of the disease, but how are you? And but yeah, I just said, hey, I'm I'm so worn out, very fatigued, and that week actually made a difference. It helped. So.
Right. To help get your counts back up and your fatigue
Mhm.
would wane a little. So fatigue was a major symptom. What other side effect? What other side effects were you dealing with, and what helped you with those side effects?
Okay. Yep. So, and like he stated at the very beginning, a few of his patients get nauseous because I think he tries to prefront that and handle the nausea. The days I was nauseous was, and because he's kind of said, you should drink water, were the simultaneous days, like that first day of radiation and chemo. I would go to chemo the next day. Those next mornings, I would feel kind of, not at the worst, not any type of nausea at its worst, but I'd feel a little queasy, those mornings. But try to drink water and try to stay hydrated, to maintain that. The hair fell out, after I got out of the hospital, and my mom was helping me comb my hair. And if you like a little office trash can, my hair at the time I had an afro, and so that all my hair completely filled that trash can, just coming out in clumps. And I had like little sprigs of hair, so I went to my hairdresser and just got it shaved off. Yeah, and it was bald, and I'd kind of come to the resolution before that I wasn't going to wear a wig because it was too hot for me,
Yeah.
and I didn't know what my head was going to look like underneath, but I just, resolved to the fact that I would be bald.
Yeah.
Um,
Can
and
you describe that decision of when you decided, let's just shave this off, and how it felt? And then maybe also just share any other tips you have for people dealing with hair loss.
oh yeah, and actually I just went with this with my friend who's just recently diagnosed with uterine cancer. So when the oncologist tells you you could lose your hair or could not, maybe it's going to stay in. Right then is when I decided, okay, I'm going to get some hats or wear some scarves. I'm not going to wear a wig. In my head, I had already resolved that fact. I didn't know what it was going to look like. I still didn't know for sure what was going to happen. I didn't know what that process of losing my hair was going to look like. Um, and then my head, my scalp became tender, like it hurt, when my hair fell out. And who knows? I mean, my hair was braided when I was in the hospital, coming back out, and then having that afro and just coming out in clumps. And then I looked like, when it was scraggly in my head, I said, I looked like a cancer patient, although that's very stereotypical, but my hair looked like little sprigs coming out of it. So I said, okay, it's better just to get it clean shaven and maybe it'll grow back even. And
Right.
my mom was there with me at the time. So we went over to the hairdresser, and I remember her closing the door to give me some privacy, and she just cut it off. So I think, though, if people, I, I mean, wigs are beautiful. Now I see a lot of the, very stylish, and I just didn't want it because it was so hot. My head, it would feel like it was hot on my head. But
Yeah.
now I see them, like you'll see in some of my other advocacy ones. I used to wear a wig to chemo sometimes, an afro wigs, act like that was my, hair again. Mhm.
That's wonderful. Thank you for sharing that. And I hear you on the wigs. I did, when I lost my hair, I had bought a wig, and it was pricey, and I wore it maybe like twice.
Mhm.
And I know different people have different circumstances. I was going through hot flashes from the Lupron shots and all that stuff. So everyone can just make the decision that's best for them. You've got the
Yeah.
hats, you've got hair that they attach to hats so that
Yep.
it's cool on top. I mean, there are a lot of different resources now.
And you're right, I did have hot flat because I remember
Mhm.
I remember, joking with my coworker at the time who, she was older, and she would always have a fan on. I'm like, "It's always so cold in here." You have to turn this fan off. And then I said, "I know what you're going through now because,
Yes.
having these hot flashes. Now I can't joke with you anymore."
Right. Now you can relate, right?
Yeah. Uh-huh.
I lived in San Francisco at the time, and it's known for the fog, and I used to hate fog. And after that experience, I love fog. I love that weather. It's just so cool and
Right.
calming.
Yeah, it's like now I understand, like, now I can walk in your shoes. I understand why
Right.
you have that little fan on. Yep.
Exactly. Yeah, best path to empathy, right? Just to understanding. So you experience these side effects, but outside of that, it seems things were going smoothly in terms of just the treatment. You described the chemo. Was there, I know you had, so it was radiation, 22 sessions. That was for the chest, right?
Mhm.
Um, can you describe the radiation process for people who are also kind of nervous about it? Like, what does it feel like? What's the human experience?
Oh, yeah. So the radiation treatment, and I learned to for all of these tests because, and for me, I guess you have to understand it was very painful initially to lay down flat. It was extremely painful. It's hard to breathe. I would cough, and all of these tests, MRIs, CAT scans, even radiation treatment, you had to lay down flat, and so I had to come up with a systematic way of laying there, and I'd close my eyes, and the machine over you it moves. So I would count like how many times to know how the treatment was over. I'm like, one, two, I would in my head, I kind of visualize how many times I had to move and get up from the radiation treatment. And aside from the radiation treatment, a side effect was I got like a dark patch, a circle in my front and back from where the radiation was. And they tell you some products to use beforehand, like Aquifer. And so I started using some of those, not during the treatment, after you could put the Aquifer on and things to treat those scars. So I still have scars even from the surgery that I call my battle wounds. That it took a long time for that dark patch to like fade, the dark patch from the front and back. But it's just something you notice like after the fact. I don't think I noticed it during treatment. You just look down one day and like,
Like,
wow,
oh,
look at that dark treatment. And
right.
I do remember having like I couldn't swallow, like it was so painful even to swallow saliva at one point from that treatment. And I don't know what made the pain go away. I don't know if it's like just as they re-imaged the area, but I could remember laying on the sofa and it just being indescribable pain to just to swallow, saliva from that radiation treatment. But by far, and you don't know what side effects are coming from what because I was doing both at the same time.
Right,
The
right.
chemotherapy, so my red blood cell counts were down. I had to take shots for that. My white, of course, the chemo for the white blood cell shots. But you know, you just have simultaneous side effects that you can't pinpoint what's coming from what.
Specifically. Right,
Yeah.
right. And when you talk about surgery, you're talking about the biopsies or
Oh, the surgery, the maybe the pericardial window surgery or something.
oh,
Mhm,
okay.
mhm.
Okay. Is that common for people? It's just because you had fluid around the heart?
Yeah, that I don't know. I don't know how common it is. I don't know if it was just me. They also did the biopsy of the pericardial sac to make sure no cancer
Mm,
got in there. That's a good question, though. And I know maybe two other people with small cell, but I've never asked them that. I'm not sure if they had
okay.
pericardial window.
Okay. So
Yeah.
something that might just be specific for if someone has fluid buildup or something like
Yes. Hmm.
that.
Hmm.
So after your chest radiation, then you eventually the following year, I mean, your treatment was going crossing into the next year, and then chemo ended in April,
Yes, chemo
and
ended late April.
late
Hmm.
April, and the chest radiation had ended a couple months prior to that. But
Hmm.
then you had to start a few months later in January, brain radiation. Can you describe the path to that
Yep,
decision?
and I think it was either June or July, and I remember the, research coming out because by then I was reading everything about prophylactic cranial brain radiation, and, this is the time I thought I would be able to navigate my choices. During chemo, I had met a lot of cancer patients, mostly breast cancer patients, met somebody with stomach cancer, and they would tell their stories, like, "Oh, well, no, I got surgery and then I didn't have to do this," or and my church had a cancer ministry, so I'm meeting people like, "Oh yeah, I chose not to do X, Y, Z." I was like, "You had choices," I'm like, "Wow, you got to choose." And so when this news started to break in my head, I was like, "Okay, now I'm gonna, have choices. I'm gonna, have options and tell my oncologist, basically, can I choose not to do this or choose to do this?" And even the radiation oncologist was telling me, no, I think I went in and I knew what he was gonna say. He was like, "Okay, now we can start looking at," because they wanted to make sure that the first there had to be a lapse, between your treatment. And so I said, "Oh, I know what you're probably going to say." I already knew what he was going to say. And I was like, "Do I have an option?" I even asked the radiation oncologist. I said, "Would you get it done?" She's like, yes." And so then I began the brain radiation, and if I remember correctly, I think it was 13 days of brain radiation that I had. Now that process was very different than the chest radiation because you get it looked like mesh, like a mask, and they
Mhm.
conform it to your face, and they kind of tack it down to the table, and this mask is over you. Um, and I decided to keep the mask after treatment because I said every year I'm a cancer survivor. I'm gonna, even though I never followed through, I was like, I'm gonna put a sticker on here every year, my cancer
Yeah,
anniversary.
a little celebration.
Mhm.
And so you said it's a different process. How long were the radiation sessions, and do you have any guidance for people on getting through that particular kind of radiation
Oh
session?
yeah. Now that's again, I close my eyes and try to count how many times that machine. Now, if you are claustrophobic or you don't like anything over your face, just try to breathe in or do some breathing exercises. Keep your eyes closed during that treatment or when they put it over you. It's not because it's mesh, so it's not like it feels like you're like wearing the face mask now, since we're in this world, is probably worse than having that mask. And now who knows how they do it now, and now there's so much technology, even cyberknife, or,
Right.
or how they can do it. But and then the key is to lay as still as
Mm.
possible, don't move, and it will be over quickly. And that was my uh, MO throughout all of those, to just lay there, get it over with,
Yeah.
count how many times to get out of there.
And were you able to, for the chemo as well as the two different kinds of radiation, were you able to drive yourself, or did you require someone to have to take you places?
Yep. So the brain radiation during the chemo and stuff, they drove me to all of those because the some of the medications I was on also made me very drowsy, so I couldn't really drive. And
Right.
loopy, some of those pain medications, kind of out of it.
Right.
So they gave it to me. I mean, the church organized those rides for me to pick me up, and I would drive myself to go get the blood work on the weeks I didn't have the chemo because I wasn't on the pain medications the whole time, or the anti-nausea medications made me drowsy too. Um, so they drove me to those, and I remember the last day of my brain radiation was my first day back at work. So I'd missed a whole half of the school year.
Oh, wow.
Um, and the kids weren't there yet, but it was the pre-work for the teachers. So I went in and left to go get my last brain radiation treatment.
And then you went right back to work. My
Yeah,
God.
well, the next day, yeah, I did, like, I came in that morning for check-in and did half a day and left to go get the brain radiation treatment.
I mean, I get that you're a hard worker, you're like a driven person. I could get that right when we started talking.
Now,
But,
who knows where my mind was then? I'm like, okay, like, I'm tired of sitting here, and I have no idea
mm,
what. Yeah.
I'm curious, like, do you have any reflections about, should you have taken more time off, or was it like, I really need to get my mind off of this and go back to some sense of normalcy? Like, what was that for you?
Yeah, I probably took the right amount of time off because it was good to have a clear start. Originally, I was supposed to go back like in May, so I would have missed months and come back like almost mid school year trying to wrap up. So it was kind of a clean break to start back. And now it ended up that I still had to. Then I was strategic about the time I still had to take because I was going back every couple months for checkups and more scans. I remember even my aunt working it out. One time I had to get a bone scan, so I I went to work. Somebody picked me up from work, took me to the hospital to get injected with that substance they inject you with for a bone scan. I don't know what it is. I forgot, some radioactive stuff. Went to go get injected, and you have to wait a couple hours. So they brought me back to work, finished the day out, went back to the hospital to get scanned. I have no idea what kind of. I think then because I had no leave, so I had to like
Wow.
strategically work things out.
Do you have any tips for people when they think about whether they should be taking time off, or is it just such a
Oh no,
personal choice?
this is a good conversation. I mean, really, I just went through this with my coworker, and I was telling her, you have to, if you have to take off, because I could remember walking into, we have a sick bank leave, and you have to go fill out the paperwork with our union, our bargaining agreement. And I said, Mom, they're going to see me walking in here, and so see, this is a stigma with cancer. Sometimes people say you don't look sick, so. And I said, I'm going to be walking in here, and they're like, she's walking, how is she, how can she not work? And you know and I was young, but and she said, who cares, your doctor has written this note for you and says you can't work. And looking back, I know there's no way I could have worked, at that time, I didn't envision how much I was gonna be going back and forth to the doctor and
Yeah.
how long these chemo sessions actually was. Like, I was in there like 6 hours or something all the time I would go, so you don't realize, yeah, you can't you could only function you can only focus on yourself. You can't focus on work right now. You can't do
Yeah.
that. It's not plausible. And
Right.
I think because still it was like a whole shift, like, yep, day A, I'm at work. Now you're in a different life. It's almost like a different,
Totally.
yeah.
And especially in a job where you're having, it's not even, you're having to like focus on so many other beings and people, and yeah,
Yeah.
it's very a lot of energy required. So okay, so you go through, and by the way, the brain radiation, they had that 15 centimeter mass. Can you explain to me what what the thinking was? Had they seen something?
Oh yeah. So sometimes lung cancer will spread to the brain as a primary place. So this was a prophylactic. So it was prevention of the
Mhm.
cancer to spread to the brain. And that research was. I mean, I'm sure they had been doing studies before, but I was just reading the research around the time I was sick, and even after that treatment, I remember them going back to the surgeon because part of the mass was still there. It wasn't active on the PET. At that time. I could get more PET scans than just the initial diagnosis.
Right.
Now insurance has kind of changed, and they, so there was no signs of cancer, but they thought it was like the scar tissue, the tumor just
Mhm.
folding in on itself. But they couldn't do surgery because they were going to remove that because the remaining mass was on my pulmonary vein. And so if they cut that,
I
then I
see.
could die on the operating table.
And you're
Yeah.
doing
I mean, so I said, okay, I mean, that was probably the most devastating for me to
right.
go through all that and get to it. And I said, I want no part of this. And then to hear, oh, it's going to be there, it's like, I just want, I've gone through all this. I want it out,
Mhm.
and so that was probably like almost the only, like not the only, but one of the breaking points, when they said, "Oh no, we can't do that surgery."
So at the end of your treatment, how did it all look? And
Oh yeah, so I still had and the brain radiation, just like the dark spot that was on my chest, I think I had some pictures of that, but I didn't send them in because I was with some family members. I didn't, don't like to be on the internet, but my whole scalp, the top of it was dark, and it was odd because I had hair like here at the nape of my neck, so it looked like a mullet with no hair on the top. And so then I had to get that cleared up, cut in the back too. It was interesting that the hair grew there, and I guess that's the part where the brain radiation was just, the cranial part up here. And I I would get some type of ointment for my head too, my scalp. I was still bald, but I didn't, until looking at the pictures, I didn't realize how dark my scalp was. Like, it was a two-tone
right.
for my head. Yeah. So I yeah, I now just thinking back on some of the stuff, I don't know how till you look at the picture, you don't really know what you look like. I think in the mirror, I don't know why I didn't notice it. But
Mm.
oh yeah, what else did you ask? I'm sorry. Look,
No, no, not at all. Just, at the end of your treatment, did you have a final scan, and what did it look
oh,
like?
oh yeah. So yep. So even in March of that year, so in December when I was hospitalized in January, and or December, late in December, January started the radiation. By March, the scans started coming back clear. The PET scans, there's no evidence of the disease,
Wonderful.
but the cycle still continued, until the
Right.
end of April. And then the regimen went to, I believe it was like every 4 months to get a scans. And then it went to every 6 months. And then by the time I turned 35, they were like, oh, before I turned 35, they were like, "Oh yeah, when you turn 35, you have to go get regular mammograms because the radiation to your chest puts you at risk
Mhm.
for breast cancer."
And
And
the fun keeps coming.
yeah, I was like, I said, I remember, in my head, I'm like, I remember signing my life away, but I don't remember reading that
This
specific side
part,
effect.
yeah.
Mhm.
Well, I'm so glad though that your scans were starting to show the NED, and that you've been good since then, right? You've
Mhm.
you've, you've been healthy. My last question to you on this segment before we move into the advocacy is just, well, first, the pick line
Oh
that you
yeah.
end up using. Do you have any tips for people on maneuvering life with the pick line? And then, yeah.
And I guess, what, now looking back, I guess you could relate it like an IV. It's not going to be in there permanently, but it's in a better position because it was kind of in my upper arm, it wasn't like right here, the bending part of your arm.
Mhm.
Um, and you're awake when they do the procedure, so it's not invasive.
Right.
Um, and they could treat. Now I don't know if they do it for people if they're outpatient, but it was fine because I was already in the hospital and they could um, maneuver it or treat it right there.
Right, right, okay. Yeah,
Hmm.
I had a PICC line outpatient, I had that and a port,
Oh,
but,
okay.
like you sometimes people are worried about the showering. I mean, these, like, are
Yeah.
the day-to-day things you don't think about, but
Yeah.
they do have arm coverings
Yeah.
now, you
Oh,
know.
yeah, I just came from my checkup at the cancer treatment center, and, they all the coverings, they're putting a covering in there for, even the
Yeah,
IV because they had started an IV, and I'm like and those are much better because I knew Band-Aids used to, like, tear my skin, so that new
right.
bandage they have that can wrap around you is really good.
All these advancements seem small, but they mean a lot for quality of life
Oh, yeah, yeah.
purposes.
Yeah, for people who don't think about these little things,
Right.
picking like, I can remember peeling them off very slowly, some of those bandages, I'm like, you hold your breath and, like, pull it off.
Well, so we're gonna move to the last segment. We'll talk a little bit about the mental, emotional health part of it, the advocacy work, and so you don't want to miss this. We're gonna stick around for this last segment with Montessa.
Okay.